Senior citizens are concerned about the future of their health care. Please welcome the Executive Director of the Longevity Center at St. Vincent Medical Center in Little Rock, Arkansas, Dr. David Lipschitz. Dr. David, welcome.
Thank you. Thank you, Governor.
In the interest of full disclosure, I've got to tell people that I've known you for many years and have had the greatest of respect.
You too.
And you still came on the show. That's what's remarkable.
You, Governor. I really think you really were one of the most fair and balanced men I've ever seen in public office.
Well, I appreciate that very, very much. Thank you. I wanted you here because from your shows on PBS nationally, your writings, I don't know of anybody in the country that knows more about the process of aging and aging issues than you do. Yeah. Now, people who are senior adults are scared to death about Obamacare. Should they be?
Well, to be frank, I don't think they should. But at the same time, I also think everybody should understand that one of the biggest crises facing us in the future is the graying of America. After all, 72 million people are advancing inexorably towards old age. In the next 20 years, the percentage of the population over the age of 65 will double, and they utilize 65% of all healthcare costs. All of us are going to reach the age of 85, and that percentage of the population will triple, and half of us are dependent. So unless we develop a solution to healthcare, our future looks very bleak.
The concern people have is about rationing, that we're going to start saying, I'm sorry, but we've decided that you're not going to be able to get that treatment.
Governor, the problem is not that we do too little, but we do too much. We do too much of the wrong care and not enough of the right care. Unfortunately, we all know that half of our healthcare dollars is spent on unnecessary, inappropriate, and expensive care, and it's largely determined by physicians.
But if physicians are only reimbursed because they do procedures, wouldn't we be better if we started paying physicians based on the outcome and the quality of care?
There are a couple of serious concerns. Firstly, there are no primary care physicians in our country anymore. Secondly, we're paid for procedures. The more we do, the more we're paid. That doesn't work. If you cut the costs to doctors, they're going to do more. We have to change the way in which physicians are paid. If we don't do that, we're doomed. But we also have to empower our patients, everybody out there, to understand that you need to be involved and educated about healthcare decisions.
It really does.
You can't leave it to your doctor.
You know, that you're making a point that I think many of us have tried to make, is that you shouldn't trust insurance companies, you shouldn't trust the government, you ought to trust yourself.
And don't trust your doctor. Just because he or she says something doesn't necessarily mean it's the truth. You have to be empowered and treat your relationship with your physician as a professional.
But you do say that we need to pay doctors a reasonable, fair return.
There is no question that we need to pay the physicians who do in-the-trenches care.
The primary care physicians.
I am an in-the-trenches doctor. I'm out there taking care of patients on a daily basis. I know what the issues are. There is nobody who wants to do what I do because no one is paid sufficiently to practice primary care. Rather, we pay for high-quality, high-tech care, and as a consequence, our doctors are going into the wrong fields. We're spending too much money on the wrong issues, and as a consequence, we're facing a disaster.
If we put several million new people into the system, who's going to care for them? We don't have primary care physicians to take care of the population we've got.
Firstly, Governor, I think there are two issues here. There are the uninsured Americans, all of whom are under the age of 65. And there are people like me. Every 5 seconds, someone's turning 65 years of age and older. We're already covered with health care, but to be frank, unless we do something, no one will be out there or available or able to take care of me in the future because the costs are astronomical. We cannot think that costs won't increase when the number of people over the age of 65 is going to double.
I've got to ask you this question. We've gotten so many email questions. We're going to get to some in a moment. But this is from Paula Johnson from Lenore City, Tennessee. She says, why is it criminal for a parent to deny a child treatment, but not when our government denies treatment? That, to me, is a powerful question.
Well, firstly, I think part of the issue is that the government shouldn't deny treatment. Insurance companies shouldn't deny treatment. The problem is that we think of that as rationing. We've got to stop practicing the wrong care and start practicing the right care, but we can't view it as rationing. We have to start being educated so that if a diagnosis is made and someone says, for example, you need open heart surgery, before you accept that, you should ask, will the surgery prolong my life? Will it improve the quality of my life? What are the complications? And where's the sound scientific evidence of benefit that what you're saying is true? And we know that a significant fraction of invasive cardiac procedures are unnecessary. And yet we do them.
We keep doing them.
We keep doing them.
Dr. David, we have to continue this conversation soon. It's so great to see you, and thank you
too,
for
Governor.
everything that you're doing out there in the trenches as a primary care physician. What do you and your